Today let's talk about coronary circulation. It is a network of arteries and veins that supplies oxygenated blood and nutrition to the myocardium. It removes deoxygenated blood and metabolic waste. Although the heart pumps blood to the entire body, it depends on its own coronary vessels for its oxygen supply. Arterial supply of heart. The coronary arteries arise from right and left aortic sinuses of ascending aorta, just above the aortic valve. Left coronary artery. The left coronary artery usually short and divides into left anterior descending artery. Left anterior descending artery runs in the anterior interventricular groove and it supplies anterior wall of left ventricle, anterior two-thirds of interventricular septum and the apex, often called widowmaker because proximal occlusion of left anterior descending artery can cause a large myocardial infarction. Left circumflex artery runs in the left atrioventricular groove, supplies the lateral and posterolateral wall of left ventricle and left atrium. It may give rise to posterior descending artery in left dominant circulation. The right coronary artery runs in the right and atrioventricular groove and supplies to right atrium, most of the right ventricle, inferior wall of left ventricle, posterior one-third of interventricular septum in most people. Common supplies the SA node and AV node. Coronary dominance. Dominance is determined by which artery gives rise to the posterior descending artery. Right dominance, right coronary artery gives rise to posterior descending artery around 70 to 85% of time. Left dominance, left circumflex gives rise to posterior descending artery around 8 to 15%. Co-dominance, both right coronary and left circumflex contribute. This happens around 7 to 20%. The venous drainage of heart. Most venous blood drain into coronary sinus, which empties into the right atrium. Major tributaries of venous drainage is great cardiac vein, middle cardiac vein, small cardiac vein, posterior vein of left ventricle. Some blood also drain directly into the heart chamber through the Bayesian veins. The physiology. Coronary blood flow occurs predominantly during diastole, especially in the left coronary artery because systolic contraction compress the intramyocardial vessels. Normal coronary blood flow is approximately 225 to 250 ml per minute, representing about 4 to 5% of cardiac output. The myocardial oxygen extraction is high, about 70 to 80% at rest. So increased oxygen demand met mainly by increasing coronary blood flow rather than oxygen extraction. High yield examination points regarding coronary circulation is coronary arteries originate from the aortic sinus. Left coronary flow occurs mainly during diastole. The left anterior descending supply, the anterior wall, apex anterior two-thirds of interventricular septum. Coronary dominance depends on the origin of posterior descending artery. The coronary sinus is the main venous drainage of heart.